So if you've got some trauma, why can't you just take some MDMA and go through a journey and deal with it, right? Well, I don't know. I don't know if in the future we're going to have some guided meditations that allow people to do that. At this present time, at the taping of this video, MDMA therapy for PTSD, you really need to have solid, trustworthy, capable adults with the patient/client. If you think about the idea that most trauma comes from the concept that we had emotional needs that were not met at some point. That's why trauma is so individual. Some people get bullied and have zero trauma because they had a lot of support at home, and some people get bullied and have tremendous trauma because they had needs for validation and for safety that were not met. Trauma is very, very individual. So what MDMA therapy does is it allows the patient to calm their body down, to address those fears, and the therapist and guide or the two therapists act as the adults in the room providing support, providing the need that was not met at the time. There were a few times during my therapy, especially in the third journey, where I very blatantly was reparented. I just came right out and said, how do you know things are going to be okay? And my therapist things are going to be okay. And because she was female, that became the female mother voice saying, things are going to be okay. And that is what I did not get when I was a child. So can MDMA help if you're just kind of sitting in your house? I'm not sure. I do know that for PTSD and for trauma, having somebody else in the room to help, it was absolutely necessary.